Okay, good evening, everyone, and let's welcome everyone to our webinar series. This is number 13 in the series, and we are number 13 in the series, and today we have a special discussion. It's not going to be talking so much about water and sewage. Today we will be focusing on something which is probably affecting most of us during this COVID-19 period, and that has to do with managing anxiety and stress. And this webinar series will begin by exploring the real and perceived effects the COVID-19 pandemic has had on us and what will be the lasting impact. We will try to identify tools and skills to manage anxiety and depression and set realistic, achievable goals. So today's topic will include discussions on workplace today and the future, long and short-term changes and the impact on our daily lives, balance at home and work priorities, and managing stress and working with an anxious public during these difficult times. And our special guest this afternoon has worked with CAWASA previously. She's a human resource management consultant who has worked with our human resource managers previously. And we have had her down in the Caribbean in St. Lucia, working with our HR managers at I think it was about 2017 at our HR seminar for HR managers. She is Miss Sheree Barron of IMS-Professional Edge Coaching of Canada. And I'm going to hand over to Sheree right now.
Okay, thank you very much.
So I will allow you, Sheree, you can do your screen share and all of that.
Okay, so my share screen should be on now, and I'm going to go to my presentation. What's it done here? Okay.
The floor is all yours.
Thank you very much. Good afternoon, everyone. I just need a moment to get my screen back to where it should be. Screen. Trying to open my presentation here. What's it done? This went smoothly the other day. Okay, so. Oh, my apologies, it's not coming up. Are you hearing me?
Yeah, I'm hearing you. You just have to do the share screen and it should pop up.
Okay.
There we go.
Gotcha. Now I need to get my presentation up.
You've got your...
It's gone.
I think you got to go.
There it comes. There it comes now.
Yeah, good.
There we go.
Right. And you go to the slideshow so you can...
Yes, that's right. We got that now. There we are. A little bit of a slow start. I've had my technical issues this afternoon with my computer, so I do apologize.
Yeah,
a little bit of anxiety, no depression, just a little anxiety just to start the show. Good afternoon, everyone, and welcome. Thank you for taking the time out to have this little discussion. Managing anxiety and depression is important at any time, but really has come to the surface more recently with all the challenges around the COVID-19, what we have to deal with in the workplace, as well as at home. And even when we visit locations outside of home or work, just simply, I know up here in Canada, big challenges when you go to just the grocery store and all the requirements that are now being made of us. But as technicians, you are in a special category, I believe. Some of the challenges having to go into other organizations and meeting their requirements. That can cause a little bit of anxiety. But most important is understanding what COVID has done for the whole world. It's created quite the challenges. We've got a global health crisis that we're looking at, with significant numbers of the world population becoming infected with COVID-19. And while we did see a little bit of a slowdown, at this time we're seeing a growth again. And that has some cause for concern. Of course, there's the global economic crisis that has resulted with every country in the world shut down for a period of time, some longer than others, but without any flow of economics, any flow of money. That creates a lot of challenge. With the financial market, of course, with the interruptions in the supply chain, we're still feeling the effects of that. For example, our car parts are still not available as they used to be. And of course, we've got increased unemployment worldwide because everyone, every country, every company had to go through a shutdown, something that we would not have anticipated even in January of the beginning of this 2020. Of course, there's been humanitarian crisis with the lockdown. We're finding here in Canada, there's more depression, especially among our young people, because of the lack of communication, the lack of social activities that we've been experiencing. And of course, the young people are suffering, but the seniors are suffering even more because we are still isolating our seniors here in Canada. And so that's been since March, and it was only in August that we started to open a little, but we're still restricting interactions. School closures, well, school in Ontario opened today. School closed for March and just reopened. So there's been lots of challenges and anxiety around the opening of school and understanding social distance. But in your location, obviously the travel bans will have had a big effect on your economy. And then, of course, as I say, when we get down into the day-to-day routines as a technician, I don't know, I'm going to ask for a little bit of feedback as to what you're experiencing. I don't know if you have to be screened when you go into locations as you do here in Canada. And so I'd like to take a moment and just ask for perhaps one or two comments, if you don't mind. I know you're used to the Zoom meeting, so perhaps if you want to jump in, or if you want to raise a hand and then unmute your microphone and perhaps just give me a couple of comments. As a technician, what are you experiencing that's new in regards to, for example, screening or just going into the various organizations?
Participants, you can feel free to unmute if you wish to make a comment. You could raise your hand and please go ahead. We want this to be very interactive.
Yes, thank you.
Well, in our case here in Dominica, as water treatment officers, really we only go to our facilities, our plants, and our chlorinator houses. So really and truly, we don't really need that screening to go in other organizations since we deal with our areas.
Okay. Okay, thank you for that comment. Is there any countries or any organizations where you're required to do any screening to go in? I'm giving a little time. Go ahead, please.
I see somebody was had unmuted the mic but disappeared. Is it Tyler Huggins? Or is it? You can go ahead, or you can write your comment in the chat room as well if you so.
Oh, that would be helpful. Yes, I think sometimes the response on the internet is a little slow. I don't see anyone else unmuted. Is that correct? I will proceed then.
Yeah, go ahead.
Okay, thank you. Some of the challenges we're facing here in North America include delayed salary reviews, reduced funds or frozen salary. Many people are still not back to work. Some of the economic effects include money being spent to enable industries with economic stimulus packages. Of course, our government has been putting in millions of dollars to try to help keep our economy going, but no surprise, half of our employers think that COVID-19 will have a negative effect on business over the next year, and no one is really sure what the impact will be over the next 2 years. Employers must make rapid and dramatic change in how they focus and the workforce and how they respond. While the focus on public health, economic and social implications of the pandemic, workforce implications are very profound because we need to help people to understand that during a time of crisis such as COVID, your input in the workplace is still crucial, it's still important. And while there can be a fear and a thought that perhaps it's important for me to stay home, protect myself and my family, we are a community, and as such, the community needs to keep moving ahead. So let's look a little bit at some of the anxiety that may be resulting from COVID or some personal responses to the COVID. Anxiety is an emotion which is characterized by feelings of tension, worrisome thoughts, and sometimes even some physical changes, like increase in blood pressure. People with anxiety as a disorder have a recurring thought or concerns that they feel they cannot avoid these situations and they feel very worried. And that's a bit of a more long-term kind of effect. On a short term, we can have anxiety that at the moment we feel a need to escape the situation, or perhaps we even get a little frustrated with the people around us. It's not uncommon to feel this fight or flight response when anxiety comes. But having anxiety as a health condition it can be very serious, and there's many treatments, but when the stress builds up, it's harder to control. So when we have big events like COVID-19, if we see changes in our own behavior or changes in behavior of people around us, those who are typically more understanding or more patient and they seem to be short-tempered, it's very important for us to try to open a conversation if that's possible. If it's a coworker, try not to jump to conclusions, to accuse them as a person because of how they're reacting in that specific situation. We need to understand that because of the results of anxiety that are triggering these fight or flight responses, that particular person or even myself may not be responding in the way that I normally would. There are some good tips that help to keep us calm when anxiety is in the wake. For example, to take a moment and breathe, to try to slow down that feeling of anxiousness. To even admit to yourself that, you know, I am feeling angry and maybe it is from being anxious. Try to understand that maybe my thoughts aren't being as reasonable as they can be. Try not to give in to anger. Try to use visualization to calm yourself. And sometimes it's very helpful to listen to relaxing music. Depression, on the other hand, can be a result of long-term or ongoing anxiety. And depression is a mood disorder that creates a feeling of sadness, maybe a lack of interest in what's going on. Everyone experiences depression in a different way, but a combination of factors that contribute to developing depression is very important for us to try to identify. And for example, if we find we're late now on a regular basis for attending to our work duties, whereas we used to be very on time and very organized and very particular, now we find that we're getting disorganized. Our, let's just say, for example, our tools aren't as put together as they used to be. We're maybe regularly late for assignments. That could create a feeling of depression in us, or the depression can be causing us to feel these outside control issues that are causing the disorganization. So it's very important to be able to understand that it's not unusual when we have crisis going on around us. Life events can be a continuing difficulty. For example, hopefully not in the case of utilities, but in the case of other people in the family, could be a facing of long-term unemployment as a result of some of the economic challenges related with our COVID. I know that many of the islands are still a bubble, which means that you're not allowing tourism to come in, which can create some stress for the family as a whole. But the key is not to allow ourselves to get caught up in ongoing long-term stress without seeking help if necessary. And sometimes that's as simple as talking to someone in our HR department and just to say, I need to have a chat, I need to open a conversation to try to help with dealing with certain issues. Now, on the other side of the coin, dealing with customers who may be experiencing some of these results of the COVID in respect to financial issues, and maybe they're being a little more stressful when you're coming to meet their needs. That can create some stress. And the key for you is to try to listen, try not to solve problems that are outside of the realm of the technical area, but try to bring the customer back, focus on what needs to get done. What are the issues related to the specific concern for you that you can address? Again, I'd like to open up and ask if there's any questions or comments in regard to dealing with, say, some of the external customers or even some of your internal coworkers. Are there any challenges that you're facing in dealing with the results, because of our COVID situation? We always say it's the COVID-19, but any comments that you can help me with?
I'm down in the chat room. You could see somebody, Julius George, left a message there. That was from your previous opening.
Okay, let me open my chat. Oops, it did not come up on my screen.
He says that here in Trinidad, we have increased working hours to minimize close contact with others. Also, the company has provided sanitizers, and also regular cleaning activities are performed in the facility.
Excellent. That's some of the same kind of procedures that we're following up here. Do you find that it's making the days that much longer and a little bit more challenging? I'm not getting my chat up, so I cannot see a response. So I do apologize on that. I'm not sure why. Moving ahead, some of the tips that we can use to help manage anxiety and depression. One of the most important tips we talk about is actual exercise. Now, the nice thing with living in a climate that you're in is that the chance to get involved in just some very simple exercise like walking, to increase the cardio, some simple weight training, always advised when trying to help build up our immune to our stress. To help the immune system itself, we look at a low carbohydrate diet. And when we say low carbohydrate, we're talking the white flour type diet. Any of the white foods, white rice, white bread. It's very good to keep the more vegetable-based, fruit-based carbohydrates, which again are very available in the Caribbean. So that's a real big bonus. But we do say that if we can keep the white flour carbohydrates, which create more stress on the body, then that helps us to manage our anxiety and our depression a little bit better. Supplements are highly recommended. A number of supplements that are available today to help vitamin C, vitamin D, multiple vitamins being very important supplements. And a big advantage of having the internet is that one can do some research and discover what's advisable in the line of supplements to help us. Another area, number 4, we really look at socialization. Again, hopefully not a big issue there in the Caribbean. It's been a big one up here in Canada. We spent our first 4 months really limiting how many people we could see. First, our bubble was just our family members. And then starting in mid-July, we allowed our bubble to grow to 5 people outside of our household. And currently the bubble is only 10 people. So socializing is a little bit challenged, but I believe that in the Caribbean that wouldn't be as much of an issue, as I understand that most islands are a bubble in itself. And so that's a good thing. Now, another step to help with managing anxiety and depression is a relaxation and meditation. Relaxation can be as simple as taking a few minutes just to close your eyes, to think about something very positive and that creates a sense of relaxation for you. Or we have visualization and meditation where you can actually visualize on one specific item or one specific feeling that you can expand on and help you to create a sense of relaxation for your mind and for your body. So those are just some tips that we can look at there. When we're talking about COVID-19, there's no surprise. Half of employers report that COVID-19, oh, I already mentioned this, will have a negative effect on business over the next year. Now, employers are looking at how they refocus working with their employees. They're providing a lot more support in how to deal with the challenges of perhaps reemployments or perhaps just dealing with issues within the family itself. I always wonder for those who have the solid jobs in the family, how challenging that can be for you when other members of the family may be facing layoffs or unemployment. Can anyone again comment? Are you experiencing within the island some of the family members having those kinds of challenges? I wish I could see my chat. Here we go. Oh, I found my chat.
Great.
Yes, it's opened up. I only have the one. Is there another? No? Okay. One of the big issues that we're looking at here in Canada is how important the health of each individual and the contributions that our people are making toward business success. COVID-19 has really underscored that and is really helping various organizations to identify within who are the leaders within the organization. And when we say leaders, we're not specifically talking about people at the top. We're talking about leadership from within. For example, working in teams. Working in teams is becoming important again because of the stretch that we're putting on various people in various departments. And the leadership among the teams, those who are willing to offer information to help others, those who are willing to develop processes that are perhaps not currently in the organization to be able to help others is very important. Focusing on our well-being for ourselves and for members of our family, because we're looking, for example, at the weaker members of our community, the young as well as the old, the seniors, and how we're managing to protect them. And that's where the whole concept of testing temperature has become a routine, certainly here in our society. I believe it's going to be as common for you as well in the Caribbean. Wearing masks are essential. In Ontario, one cannot go anywhere into any building without wearing a mask. Can you please comment, is that still required in the Caribbean that you wear masks everywhere you go?
Yeah, I don't know. I'm not getting feedback, but I can just tell you, yes, that is so in most places. But just to
Okay.
go back on a couple of points, because some people have put in the chat room, again, with matters related to stress, one person says that the only, the sole breadwinner, and this is extremely stressful. And another person says that it is difficult for families to deal with major income cutbacks, especially in one breadwinner is involved. So I don't know if you would wish to comment on that. So there are comments coming through the chats.
Oh,
I
I'm
think
seeing
it's
them
in,
now,
yeah,
actually,
go
after
ahead.
the first set of COVID-19 cases.
Yeah.
Yes, I see. Okay, thank you. It is a challenge. And I think what we want to be looking at, for example, is what becomes essential now in the home. For us, we always thought that, you know, the most internet availability, the fastest high-speed internet was required. Cell phones being a big part of expenses here in Canada. It, cable, our cable of to be able to watch all our programs. Suddenly, those things which were a fundamental part of day-to-day life have to be valued and assessed as to how is it contributing really to the whole needs of the family and the long term. Because we're not allowing people, even with college, I don't believe that the students are allowed to go to classes yet. So one of the things that we are finding is a big challenge is redirecting some of the expenses. The key is to sit as a family, try to value what's needed for each member, and what is not as important, what used to feel like it was a necessity, maybe not so much a necessity now, and can be put on the back burner until, you know, that is allowed again. I'm just going to look at a couple more comments. Yes, it's the breadwinner. That was really directed to that person. Families deal with major income cutbacks, especially, yeah, one breadwinner. So we're getting multiple people stating the same thing with the personal financial issues. And you know, that's where we've noticed here in Canada that families are doing a lot more activities as a family, and that was because we weren't allowed to go into the social environments where young people were with other young people. So going on family walks, creating fun activities at home, which reduce the costs, but actually have brought us closer together and are helping us to learn different ways to enjoy ourselves. Um, I'm just reading again. Yes, I see everyone's letting me know where you have to wear the mask. Thank you very much. But I think when we're talking about how do we identify that I am experiencing anxiety, because the key is anxiety is not experienced the same by each person. Some people actually get shortness of breath, and with the many symptoms of COVID-19, if you start feeling shortness of breath, you can start to get worried. Am I experiencing, am I if affected by this? Whereas in reality, what you're experiencing is anxiety. And that's why we say one of the steps is to take a moment to inhale very slowly through the nose, exhale very slowly through the mouth, and then again, inhale through the nose, and this time exhale slowly through the nose. Developing a process of breathing that helps to relax the body. When the body is relaxed, we find that our thinking is more focused, and we're able to separate that which is the noise coming into our head, the noise of the concerns of how am I going to make sure that I meet all the financial requirements this month, as opposed to the noise of what if COVID-19 comes into my family. So there's various challenges that we need to talk about. very, very important to keep the verbal communication open among the family members. We are facing a challenge that young people have never faced before. Young people are now probably, afraid to socialize the way they would normally socialize because of the fear of bringing COVID-19 home, or even experiencing a result of getting the COVID-19 themselves. So again, having that conversation is very, very important. I'm going to ask at this time, when you feel stress and anxiety, and if you could just type in, that would be great. Do you think that you feel your stress regarding COVID-19? Do you feel it more before you start your workday? Do you think it happens more during the workday? Or do you think you really feel the stress more at night, just before you try to relax and sleep? Can anyone comment for me? So before you start your workday, you feel more stress, or actually during the workday, trying to balance every challenge and issue? So I'll give you a moment to think and perhaps give us a written response.
Before the workday.
Before the workday? Could you expand just a little bit for me?
Well, considering, you have so many plans, you have to get so many things done, and you haven't started, especially if there are now, with all the protocols in place, you have added responsibilities.
Yes.
So each day, it's like there is more and more to get done. And just thinking about it is stressing.
Okay, thank you. Yes, the added responsibility has certainly created more stress for us. And I guess one of the things that we have to understand is that there is a constant change. It's not that you get used to what needs to be done and you can organize, and then every day it's the same. I know what we're finding here is there is that constant change in what is required and also what is expected, especially regarding the protocols to be able to stay safe. And as someone is saying that out, trying to stay safe and carry out all the duties at the same time, it almost becomes impossible, doesn't it? So are you able to set priorities and say, okay, this has to be done within this time frame, and this is how I'm going to address that? Is that a step that anyone is doing some priority planning?
Yes, certainly, because really and truly, if we try to get everything done as we would have it on paper or beforehand, I think it would really tire us out.
Yes.
So definitely, it's prioritized.
Thank you. That is the key. I think we need to look at what is realistic. There are many requirements within the job that outside of COVID, because of the kind of work that you're involved in, outside of COVID, there are many safety issues that you have to address. And then when you add the COVID protocols, it can become a little overwhelming. Very important for you to first identify what is within your control. What can you deal with? What is realistic and possible for today? And then maybe expand it as to what will I be able to address over the next few days. So try to work on your own priorities and look at what is needed for, let's say, because I'm not sure how you go about receiving your requirements as to what needs to be done, but certainly a list may be provided to you, and then you need to establish what's realistic for you. The key here, because of the impact of COVID-19, the key here is safety protocols regarding COVID-19 actually take priority. But once the safety protocols are in place, and they're not that complicated, if it's required to wear certain kind of garments, and that that needs to be taken into consideration. Not sure that in your field of work that will be an issue COVID related, but certainly the mask might be a COVID issue. Having hand sanitizer or the ability to regularly wash your hands, something that you want to consider when you're going into a location. I see that someone wrote here, the fear of bringing it home. And of course, that's so important. But one of the, I'm not sure how available this is, but one of the things that we follow, one of the procedures that we follow here is a regular check of the person's temperature. Because one of the noted effects of COVID-19 is that if you are showing the symptoms, one of the biggest changes that happens rapidly is a change in body temperature. And it's not a change that we necessarily realize. So if in Canada, if the body temperature goes above 37.8, that's identified as an issue. So if it were an option to be able to get your temperature checked on a regular basis so that you can learn your normal and know that you're staying within your normal, that is certainly one area. I have sent what we call a screening sheet through to Suzanne, and she has shared that sheet with your HR people. And if you're interested in just a personal screening, you can ask for a copy of that, or I can share it with Mr. Shaw and he can send it out to you. It's not, the screening sheet is not intended to create a dramatic upset, but it is a useful tool to help you to identify, do I have multiple symptoms? The truth is, the many symptoms of COVID-19 are varied. And but what we always say is this new? So for example, if a person has an ongoing situation where they have regular headaches and now they have a headache today, you cannot jump to the conclusion that it's a COVID-19. You have to say, well, how many symptoms do I have? The other problem is, of course, among younger people, the symptoms often don't display themselves, and that can be a very big challenge. I'm not sure how it is in your various countries, but here in Canada, they've made it very available to be able to have COVID tests and get the results within a few days. The truth is they don't charge you here to have a COVID test, and they do encourage everyone to try to have at least a COVID test once so that you have an idea that, no, I'm not a silent carrier. Because that's where the challenge is. And when we're talking about dealing with family, very important when possible, even at home, between the younger persons, say the teenagers and the younger people, and the older people, say the family members over 60, when they're together, you should really work to keep that distance, and you should work to make sure people are wearing a mask. Because what we've learned in Canada is that many young people are what we call asymptomatic of COVID, which means that they don't show the symptoms at all, zero. But they can have experienced COVID and it could have come through their body and left without them knowing. The problem is when someone who has a weaker immune system, say someone who has asthma, someone who has a heart problem, someone who has a diabetes problem, any of those people are much more susceptible to the negative impact of COVID. So when you talk about fear of bringing it home, you want to look at the age of the people at home, and if you have parents or grandparents, you want to try to make sure you keep them protected by keeping them a distance from the younger people. I hope those comments are helpful. I'm just reading through here quickly through the chat again. So someone wrote, how much of the feeling is actual stress? I'm going to be honest, it's all actual stress because it's what you're experiencing. The key in understanding how to identify and manage stress is to see yourself on a positive, healthy, good experience day. How do you behave? And how are you today? If you note that today you are more short-tempered, or for others, it's very different. It may be that you are more wanting to drink alcohol, for example, to deal with how you're feeling because you cannot cope with that feeling. Then we say that you're having a negative response to stress, because while alcohol in a social sense is useful, if you feel that you need to drink alcohol to be able to cope, then you're overwhelmed with stress and you need to go and try to get some medical help. If you find that you're losing your temper with the family a lot, you know, not little things that you may have done before and then you get over that quickly, but you find that you're constantly losing your temper, perhaps the work stress is a little too much, and you need to spend a little more time taking a nice walk for yourself, doing activities that you enjoy. Here in Canada with summer, one of our big activities that we enjoy is just simply gardening or spending time outside, because of course we now are starting to face that change in weather, which creates its own depression and anxiety. But trying to understand what helps you to feel good, one, about you, and two, about the world around you. Things that help you to feel positive, those are activities or thoughts you want to start working with. Trying to stay safe and carried out all duties at the same time. I think we talked about that a little bit. I'm just going through here. All right, I don't see anything new. So as we just go back to the business effect for a moment, we say that businesses are having to put in place new measures for their workforce to help to keep them safe. And one of those measures we're looking at is how people work in the office, where desks should not be as close as they used to be. What we're doing here is we're separating people. We're trying to create that the 6 foot distance, or what we call the 2 meter distance. We do it in the grocery store. We do it in every lineup. And that has become a very important part of the work environment and the social environment, is to make sure that we're giving people enough space. A positive that we've learned already through Australia, in fact, who's already well into their winter season, they're learning that there's been a huge reduction in the normal kind of flus that were happening, because everyone is more conscious of keeping their distance, wearing a mask if they're not feeling well, staying home if they find that they're having any kind of flu-like symptoms. It's created a really big positive ripple effect. So everything about COVID-19 is not necessarily bad. And I wanted to just finish off in regards to the medium and long-term objectives of business. We're going to see a lot of change in that regard. Profit has always been a key issue. Of course, profit will continue to be important, but what we're seeing now is that concerns regarding health being a higher priority. Excuse me, Aggie, stop that. Sorry, my dog is making some noise in the background. I do apologize. Dealing with the change. I'm so used to the face-to-face workshops, and working through Zoom, we all have to deal with the new challenges. But it's fun to learn new things. Now, one of the other areas that business has to be able to make a change very quickly if a breakout occurs in a specific location. Here in Canada, when we have one business that has, or sorry, one organization that has multiple locations, should COVID-19 break out in one of the locations, then they isolate that location. So they don't do any interaction of change of employees between locations, to try to make sure that we don't create a spread unnecessarily. So in essence, what we're looking at is, what are the safety protocols in case COVID should come into your organization? And that's a conversation that needs to come through HR. And if you have issues or concerns regarding that, you need to open up that conversation. So I think throughout today, we've been talking already about how COVID is impacting your daily work routines. Is there any other comments that you'd like to add in the chat at this time? And that is comments regarding specifically how COVID is impacting your work routines and activities, or any other areas that you feel that you would like to expand a little more on the discussion.
Well, what I've realized is that persons are withdrawn. So before the way they would have associated with you,
Yes.
they no longer do so. They're always by themselves. They make excuses, for social events and that type of thing. It just seems very distant, especially in the workplace. Some persons, and especially those who have lost their jobs. They don't.
I didn't hear that. I'm sorry. You said in those
who have lost their jobs.
Oh, of course. Yes. Yes.
They don't really want to associate as they would have done before.
That is so true. And that's understandable. And how do we help? I guess one of the areas that we have to look at is people need space, people need time. It's a bit of a grieving process. Some of us, we're just grieving here in Canada. We are grieving because it's such a major change. We're not able to be around friends, and we are worried about how are we going to pay the bills. To be honest, in many ways we were very lucky because our government worked hard to help us, and they're trying to provide us with opportunities for short-term breaks and paying some of our bills. But that was only for the first few months. Now the reality is starting to set in because you can only get a break for so long. So it is understandable. People are withdrawing. I guess one of the keys for us, someone like me with a bit more of an outgoing personality, I'm trying to be a little more understanding. I'm trying to listen, and when possible, not necessarily offer solutions, because what maybe worked in the past is not as available or an easy solution today. But giving people an opportunity to know that they can talk, that they do have someone that's willing to listen, maybe even having that chance to open up that conversation in regards to how the general effect of the change in the work itself, focusing your comments not on the personal issues, not on the financial issues, but maybe at time trying to open a conversation by talking about the change in routine, the stress of what goes on at work. So taking it away from the person or the person's private needs and bringing the conversation about the workplace itself. And that may be a way to help people to feel safe, to be able to share some thoughts and some feelings. Any other comments?
The room seems to be pretty silent this afternoon.
Well, this is a big change in topic, I think, over what we're used to. And so, of course, it's a little bit of my job to try to draw some of your comments out. But let's talk a little more light. What are some of the positive social activities that you still feel safe to participate in your various islands? Anyone comment on that?
I know some of the changes that have taken place, Sheree, for example. I know most of the operators who are outside doing duties in the field. The way they would be, transportation is taken care of, the numbers who are traveling in the crew
Oh,
vehicles.
yes.
Yeah, this is another area. How do they react on the, although many of them may not be dealing directly with customers, but in the field, how are they affected with some of the new regimes?
Good comment and question. Can anyone give us some feedback? While we're waiting for someone there, I did get a couple of comments regarding the social activity. One person said cricket on TV, and that's a big social event. I know here we had no sports for many months. While not being allowed to go anywhere, there was also no sports on TV because no one could be involved in any of the activities. And then suddenly in August we have hockey, soccer, basketball, everything all at once. So it did bring a little bit of relief for us. Here we've got one. If a coworker tests positive and you know you've been in contact with that person, how can you prepare yourself in time? Like, all right, I have to be very honest with you. If a coworker tests positive, then every person who has been in contact with that specific individual must have a COVID test. In Canada, we assume that if one person is in a building is positive, then the potential that everyone in that building could have COVID. That's how fast it goes. And just to give you a little background, I have been the last many months working in a seniors facility. And in the various seniors facilities here in the city that I live in, if there's one case of COVID, then the whole building shuts down. No external people are allowed in. And the people within are all tested. And then those who are positive are isolated for 14 days. The key with COVID is because you become infected does not mean that you're going to suffer all the big negative impact and all the death that we saw in the beginning. Sadly, the truth is COVID affects the weak in a very negative way. And when I say the weak, I mean someone like myself who has an immune system that's extremely compromised. I have asthma, I have muscular dystrophy. I have a number of autoimmune issues, and so I'm considered a high risk. I'm considered a person that should I get COVID-19, it may progress to a more negative level. Nevertheless, I still worked full time and I still continued my life because I felt that I would rather do that than lock myself in a room. For many of the people who work within the water facilities as technical people, I'm expecting that you have regular medical checkups, that you keep good, healthy records. And should one person get COVID-19, the chances are, yes, others will get it. Yes, everyone should be tested. But no, it does not mean that you will become extremely ill. So please don't put that on your plate and be worried that, oh, I'm going to get, really, really sick. The truth is, here in North America, we have a bigger issue because of the weather. The weather brings on more flus, more effects, more asthma, and more of all these other effects. One of the real positives of living in the Caribbean, and not that you should take it for granted and not eat well and not have your vitamins and your supplements, but one of the positives is just the whole Caribbean environment, the air, the sea air, the sun. All those are very positive things that will help. And it probably helped because I don't think there's any islands that have suffered extreme. I believe it's some of the inland countries, I think Brazil being a really high number of COVID, up there in the world with India and China and the US. Those inland countries with huge populations are the ones that are suffering the most. What we find, I live in a small community, And what we find, even though, as I say, if one person tests positive, we shut down the facility, we clean everything, we ensure that people are very careful not to breathe on each other, and we wash hands and so on. And we've done extremely well in the sense of, yeah, we've had COVID, but we have not had a lot of illness or death. So it's not all as negative as the TV. The TV is a big anxiety creator. The TV really can make it negative.
You have another point in the, I think I know about 2 utilities who have had some scares where I think one worker was in contact with someone who had tested positive, and another one I think was, there were 2 cases like that of 2 utilities, and I wouldn't name them here, but what was done, they had to immediately shut down the entire operations and get everybody screened and checked before.
And it seems like a big scary thing, but really, if you do it right, if you just shut down and you just clean, because let me use an example of a name that many people may be familiar with, but it's a store called Walmart. Walmart in Canada and the US is the big place to go shopping. And we had here in Barrie, my small community, we had a Walmart employee test positive. And I mean, when you look at Walmart, everyone in the community, I mean, a lot of people go through the Walmart store. Do you know, we didn't get any others. We got the one. But what they did was they shut down that store, they cleaned it, they screened everyone to ensure that it had not spread, and they kept everything under wraps until they could be sure that everyone was clear, and then they reopened again. So, you know, there's lots of precaution, and some people feel that we're overreacting when we shut down and clean. But the thing with the COVID infection is it spreads quickly, it spreads easily, but more importantly, it's very, very easy to get rid of. Simple soap and water kills it. That's what they've proven. You know, so on the surfaces, if you keep them clean, if you use soap and water or vinegar or peroxide, they find all these things really help by keeping the surface clean. We can protect ourselves, we can protect our family and our communities. Oh, I see someone wrote here in St. Lucia, we do contact tracing, so all persons would be quarantined. And that's, you know, that's what we've done here. At work, if someone even has just a cold, we say, no, don't come to work for 14 days. We've been a little bit strict about that, but, you know, we just ask them to quarantine for the 14 days. And then at the end, we ask them to do a COVID test. And, you know, it's gone really well. And I mean, I work in a community that has 200 seniors, and we've got about 130 employees. So we're looking at a lot of people, and it's really worked. We haven't had any cases. I'd like to conclude by saying I know this is a very different topic, nothing related to your day-to-day activities of how to get your job done. I hope that you found it somewhat interesting. And if there are any other topics that we call them the soft topics, if there are any other of the soft topics that you would like to explore, please share them with Mr. Jean, and we'll decide if I can be of any help, or if we can find the people that would be more suitable for that specific topic. Oh, someone just gave me a nice shout out. They said, interesting topic and good presentation. So I thank you very much. Mr. Jean, I'm going to stop sharing and bring the screen back to you.
Thank you. Right, everyone. So there we are I would like to thank Sheree again for a very good presentation. We had such a similar exercise with the HR managers last week. I'm not sure if you're hearing me.
I am hearing you, Mr.
Okay,
Jean.
right. We had a similar exercise last week, and that was very well, last Friday actually, and with the HR managers, and we want to continue in with that series. But we thought we should do something different for the operators, and not just on the technical side of things, but to look at the softer side, because we are all people working in the sector, and there are lots of human things that affect all of us. And we trust that this little insight into managing anxiety and depression you found to be useful. We, as Sheree indicated, we certainly will take any other comments and suggestions you may have when you send us responses via emails or through WhatsApp to us at CAWASA, and we can try to include some of the softer side skills and techniques in managing yourselves and respond and coping with the current challenging situation. As we, as people involved in the water and sanitation sectors, what we essentially do is providing the water that helps to keep people safe. And as indicated earlier, it is the first thing is about water, and using soap and water is some among the best remedies to deal with that. In addition to maintaining the social distancing protocols and all the other safety protocols in the workplace and at your homes. So that has been pretty good. Next week, our program will be dealing with, we'll get back into the technical with our friends from the Caribbean Desalination Association. Will be presenting on the basics of reverse osmosis system design and considerations. And of course, the membership in CAWASA has about 50% of our membership comprise desalination sources of water. So that should be of interest, not only for them, but also those in mainly the Southern Caribbean that deal with surface water. So that should be an interesting one. And we will see you next week, and thank you for joining us this afternoon, and thank you for your participation. And please feel free to send us comments and let us have some feedback on our webinars, so that we can improve on the quality of the production and to keep you informed. Thank you very much, and have a good one. Bye, everyone.